Peace be to you. This is Omar Abdul Malik, physician assistant and health educator. So I just got off from work and I'm here with my model COVID, or my model virus. So maybe I'll give him a name, COVID, the COVID virus or something. But this little guy and his progeny have caused a lot of challenges in the world amongst us humans. So that segues into my topic, which is, if you are in the process of considering a career in the healthcare, the allied healthcare field, now would be a good time to consider being a physician assistant. I've been a physician assistant for 20 years. Let's see, about 13 of those years were spent as pretty much functioning in the capacity of primary care and infectious disease and HIV medicine. And I've spent a few years teaching, and then the past 5 years have been spent as a hospitalist. Now, it's kind of interesting. It's very interesting work, especially now with the COVID-19 challenge, because I'm finding that there's a great value in being a physician assistant, not just economically and financially, but socially as well. And when I hear a lot of the information on television and the internet, there's a lot of misinformation, but my medical background as a PA helps me kind of decipher a lot of the information that's out there, as to what's accurate and what is not exactly accurate, and what else is just like flat out wrong. So right now there are about 150,000 physician assistants who are licensed and actively working in the U.S. And that pales in comparison to about, I think it's just over 1 million licensed practicing physicians, and a little over almost 4 million nurses. I think the number is like 3,800,000 registered nurses as of 2019. Now, both those professions have been around a lot longer. The physician assistant field, as we understand it now, has only been around for just over 50 years. And it was started, of course, by Dr. Eugene Stead at Duke University back in, I think, 1967. But it's a great profession. I'm going to do a more intricate video about it later, God willing, inshallah. So PAs on average right now are making about $110,000 per year, which is very good. So again, it's a financially sound decision. You need a if it's something that you really think that you want to do, it requires a graduate degree, so a 4-year undergraduate degree. Then you take the GREs and hopefully get in, and then it's 2 years after that on average. You take national boards called the PANCE. So that's the Physician Assistant National Certification Exam. And then somebody hires you, whether it's an individual physician or you start your own practice in conjunction with a supervising physician, and maybe get picked up by a hospital and get to work. So I've enjoyed it. These are very interesting times in which we're living. They're scary, but I also find them interesting. With my background, so I did my master's degree at University of Nebraska with a specialization in infectious disease, and then my first PA degree at Howard University, graduated in 2000, and then my degree in biology in '94 at University of the District of Columbia, and then my doctorate in health education at A.T. Still University, and graduated from there in 2012. So I get to use, I get to actually use all of the knowledge which I've acquired over the years and the degrees to help fight this virus and the ramifications thereof. So I'm seeing really sick patients in the hospital. We haven't had any COVID-19 patients yet, thank God. But we're preparing to be, our group is preparing to be of service once this projected onslaught comes to our area. So the DMV area, DC, Maryland, Virginia, as it has hit New York really, really hard. God help those folks. But it's a great profession. There's a lot of good you can do. You can make good money. There is prestige if you're into that kind of thing. You may have seen some of my videos about the downside of being a PA. Not everybody's going to notice you. You're not going to get the same public accolades. I've seen a lot of commercials thanking the doctors and nurses as they are on the forefront of fighting the ravages of this COVID-19. It's like, thank the doctors and brave nurses and others. So we kind of fall under that others. But you know, if you're looking for public accolades, it may not be the profession for you. But if you are, there's opportunities to get public accolades if you're into that kind of thing. But if you want to do good, if you want to be a leader in healthcare, and you want to practice medicine, you know, under the supervision of a supervising physician, of course, then being a physician assistant might work for you. It was named by U.S. News and World Report as the #2 job in America. #2 or #3, I think. And I think the #1 job in healthcare with a graduate degree. So it's projected to rise in terms of you know, jobs. There's going to be changes in the future. There's probably going to be a specific entrance exam for physician assistants. Something called the I think it's the PA-CAT, if I'm not mistaken. I'll talk about that later in another video, Lord willing. And it's probably going to become an obligatory doctorate sometime in the future. It's now an obligatory master's degree. When I first got into the PA academia, it was there were a lot of associate's programs around it, some certificate programs. But now, like I said, it requires a master's degree. But anyway, I'll put the link in the description for the AAPA, which is the American Academy of Physician Assistants, and the NCCPA, which is the National Commission on Credentializing Physician Assistants. If you have any questions, please leave your questions and comments in the comment section. I'll also give you my contact information in Instagram. But it's a great profession. It's been a great 20 years, and I look forward to having a great future, Lord willing, God willing. Okay, you guys be safe. God bless you all. Take care. Peace.